Good morning. Today I'm going to finish the second part of the skull lecture. So we talk about the bones of the skull, and as I said before, the bones of the skull divided into two portions. We have the brain case bone and we have also the facial bone. The facial bone which set the boundaries for the bony orbit, for the nasal cavity, and for the entrance of the oral cavity, whereas the brain case bone form the boundaries of the cranial cavity that enclose the brain and meninges. The other name for the brain case bone, which is the neurocranium. Usually the roof of the cavity of the inside the brain case, the roof, this is the area where we have the roof. This area here is called calvaria and usually is formed by the interparietal, parietal, and the frontal bone, whereas the lateral boundaries are formed. See, this is the area of the roof and this is the area of the lateral of the brain case bone, which are formed by the temporal bone. So this is the area again. We have this, all of these structure here are part of the facial bone, whereas the other one here we have the brain case bone. This area here where we have our brain and also we have the meninges, the tissues that surround the brain. The floor of the brain case is usually formed by the sphenoid, this bone here, this one here. This is the sphenoid bone, and also we have the occipital bone, this one here. All of these help in the formation of the floor of the brain case bone. The caudal portion this one here, this is the caudal portion, is formed by the occipital bone, whereas the cranial portion is formed by the ethmoid bone, and usually this ethmoid bone is a hidden bone. We cannot see it from outside. We have to cut and break the skull to be able to see this bone, which is the ethmoid bone. So this bone here, this is the first one here, which is the frontal, and then we have this one here, we have the parietal, and we have the one here that is the temporal bone. And you can see the one that found in the caudal portion, this one here, this will be part from the occipital bone, and this one here, this one here is the temporal bone, and the last one that found in the floor, this one here, this one is the sphenoid bone. So usually the bones of the brain case can be classified into two groups. The first group, which consists of two bones, right and left, these are called the paired bone. We have the frontal, we have the temporal, and we have the parietal. Whereas the bone that found as a singles, we have the interparietal, we have the occipital, we have the sphenoid, and finally we have the ethmoid bone. So for the brain case bone, we have 7 bones. 3 are paired, whereas 4 are found as unpaired or single. So these are the bones again. We have the frontal, we have the parietal, we have the interparietal, and the one that found here, this is the occipital, and this one here, this is the temporal. So number 1, number 2, and number 3 here are the paired bone, whereas the other bones, such as occipital or the sphenoid or the interparietal, like this one here, considered as the unpaired bone. So again here we have the frontal, we have the parietal, we have the temporal. All of these bones are paired bone because we have it on the right and the left side, whereas the one that here, this one here, this is the occipital, we have the sphenoid, we have the ethmoid, and finally we have the interparietal bone. We'll start with the first one, which is the frontal bone. The frontal bone lies between the nasal bone, this is the nasal bone, and rostrally, and caudally we have the parietal bone. So all of these boundaries here, with all of these articulation, this is the bone, the frontal. So it's articulate with the nasal bone, with maxilla, rostrally, and also with the lacrimal, and caudally it articulates with the parietal bones. So as I said, the frontal bones lies between the nasal bone and the maxilla rostrally and the parietal bone caudally. Ventrally, the frontal bone articulate with the sphenoid, palatine or palatine, and lacrimal bone. They form the rostral part of the cranial cavity. So this is the area where we have our brain. So this is the area of the cranial cavity. Inside the frontal bone, we have this space here. This space is called the frontal sinuses. This is the frontal sinus, and this sinus here we have, and it will be filled with the air, and they have a connection with the nasal cavity. This structure here is called the frontal sinus, and later we are going to talk about the paranasal sinuses. So again, this is the area of the frontal bone, and this is the area where we have the sinuses, the frontal sinus. As I said before, this area usually have like a bone, then it's going to open, and there will be like a space inside it, and this space here will be connected with the nasal cavity, so the air can be filled these spaces, and it's very important structure for cooling the air and protection for the other organs in the body. For example, it's protect the brain for any damage that can happen at this area here, because this area can break, but this one's still intact and can protect the brain. The second bone we have, which is the temporal bone, and this temporal bone contribute to the formation of the lower lateral wall and the part of the ventral wall of the cranial cavity. So this is the area which is the lateral, the lower lateral wall of the cranial cavity, and also it helps in the formation of the ventral wall of the cranial cavity. Usually the temporal bone divided into three parts. Very easy. The squamous, petrous, and we have the tympanic part. So the first one, which is the the squamous part, carries the zygomatic process rostrolaterally, which form the zygomatic arc. If you remember from the last lecture, when we talk about the zygomatic bone, we said that this bone help in formation of the zygomatic arch. We said one part is coming from the zygomatic bone and the other part coming from the temporal bone. Together these two structures and this area here is called the zygomatic arch. And usually we call this part here from the temporal bone as the zygomatic process of the temporal bone, whereas this one here we call it as the temporal process of the zygomatic bone. This structure here is very important, the squamous part, because it helps in the formation of the temporomandibular joint, the joint between the temporal bone and the mandibular. Remember when we talked in the last lecture about the mandibular notch and the coronoid and condylar process. And this is very important because this joint is very important to open and close the mouth. The second part we have, which is the petrous part, and this one peers and have the mastoid process, and this is the only part that visible from this side. The second or the third part This is number 1, number 2, and here we have number 3, which is the tympanic, which possesses the large tympanic bulla. And usually, the petrous and the tympanic part enclose the middle and the inner ear. So inside these two structures, the petrous part and the tympanic part, we have parts of the middle and the inner ear. So this is here, this is the area of the tympanic, and this is the opening, which is the acoustic opening, external acoustic opening. This one here that carry this part here, we call it as the squamous. And this part, which is bulging, this is called as the tympanic part. So here we can see this is the area of the bulging. This is called the tympanic part. We have to break this one to be able to see the petrous part. And you can see this one here, this is the flat area that carries the zygomatic process of the temporal bone. This part is called the squamous part. The third bone we have, which is the parietal bone, which is found just caudally to the frontal bone. This bone is called the parietal bone, and this is very important. They form the lateral wall of the cranial cavity. So the parietal bone are paired. They form the roof and part of the lateral side of the cranial cavity. They join the frontal bone rostrally and the occipital bone caudally. Ventrally, they have articulation, if you remember, with the temporal bone, and also they meet the squamous part of the temporal bone, and also they articulate with the sphenoid bone. We'll talk about it later. So this one here, all of this bone here, this is the parietal bone. So they articulate with the frontal, with the occipital, with the temporal, and they articulate with the sphenoid bone. And at the middle between them, we have the unpaired bone, which is the interparietal bone. Now we're going to talk about the unpaired bone of the brain case. The first one, which is the interparietal. From the name, inter is mean between two bones, so it's found between the two bones of the parietal bone. So this is the one here. We have the parietal bone, and here we have the interparietal. The one that we have at this area here, this is the interparietal bone, is a small bone which between the two parietal bones, so it's found between the two parietal bone. It fuses with the occipital bone and pairs the caudal part of the sagittal crest. This is the area we'll talk about it, which is the sagittal crest. So this is the bone here. We have the parietal. This one here, this bone here is the interparietal bone. The second bone we have, which is the occipital bone. The occipital bone is formed by paired structure, but they are fused together, so they consider as one bone. We have this one here, all of the one, all of this bone here. This bone here is the occipital bone. At the center of this bone, we have this foramen. This foramen is called the foramen magnum. And from this area here, the spinal cord is exit the cranial cavity. Usually they divide it into three regions. We have this area here, we have the area here, we have the area here, and the one that found in the ventral of the cranial cavity. This one here is the supra-occipital region. The one that here we call it as the exo-occipital, and the one that found in the ventral portion, this one here is called the baso-occipital. The dorsolateral border form the knuckle crest. So as you can see this one here, this is the dorsolateral area here. This area here is called the knuckle crest, and usually this found at the junction with the parietal and the temporal bone. So this one extends also to the level of the temporal bone. So this is the area here is called the knuckle crest. See this one here? All of this area here is called the knuckle crest. As I said, the external occipital protuberance is formed in the middle between the knuckle crest where the interparietal fuse the parietal bone. So let me go back here. See this area here? This area is called the external occipital protuberance, and this one is formed, you see here at the dorsolateral we have the knuckle crest, and in the rostral we will have the interparietal bone. So the area where the interparietal bone fused with the knuckle crest almost at the middle of the occipital bone, this structure here is called the external occipital protuberance. So this is the area, all of this area here, this is the area of the occipital. The area in the above here, we call it the supraoccipital. At the middle, we call it, and around the foramen magnum, this is the exo-occipital, and the one that found in the ventral portion of the cranial cavity, this one is called the baso-occipital. As you can see here, this is the area of the foramen magnum, and this is the area where we have our brain, where we have the spinal cord exit through the foramen magnum to reach to the level of the spinal cavity. We have also the area here where we have the occipital condyle, and this is very important. If you remember when we talk about the C1, the atlas, we said it articulate at this area here with the atlas, and this will help in the formation of the atlanto-occipital. So again, this is the area of the knuckle crest. This is the area in the middle, which is the external occipital protuberance. As I said, this area here is the foramen magnum, and from this area here where the brainstem exit and form the spinal cord. We have here the area of the occipital condyle, and we have another structure is found here which is called paracondylar process. But these are very important because they articulate with the atlas to form the atlanto-occipital joint. In the baso-occipital here we have two foramen. These two foramen are the hypoglossal canal, and this is very important because from this area here they provide a passage for the hypoglossal nerve, and this nerve is going toward the tongue, and it's a motor nerve. It is a motor nerve, so it's responsible for the contraction and movement of the tongue. The third bone we have, which is the sphenoid. The sphenoid, we can see it from the lateral surface and also from the ventral surface. This bone here is formed by two parts. The first one here, see here, almost like a triangle. See this one here, this is almost like a triangle. This one here See this? See this one here? This one here, this is the pre-sphenoid, and the one that found caudally, this one is called the basosphenoid. The basosphenoid is the one that found in the caudal, and the one that almost triangle in shape, this is the pre-sphenoid. The sphenoid for the rostral base of the brain case. From this, the sphenoid, there's three openings. We have the optic canal, we have the orbital fissure, and we have the alar canal. If we can see here, we have the first one here, which is the optic canal. From this area here passes the optic nerve. And then we have the second one, which is the orbital fissure. And we can see the last one here. This is the alar canal. And this opening here is called the rostral alar foramen, and the one that found caudal here, this is called caudal alar foramen. And there is a canal that extends from the caudal toward the rostral alar foramen. We call it as the alar canal. So this is the first one here. This is the optic nerve. As I said, it's a passageway for the optic nerve. Then we have the second opening here, which is the orbital fissure, which is a passage of the oculomotor, trochlear, and abducent and ophthalmic nerves. These nerves supply the eye and the structure that found around the eye, and we're going to talk about them when we talk about the eye anatomy. After that, we have this canal here. This canal is called the alar canal. As a canal, it has start, it has end. It starts from the caudal alar foramen and it ends at the rostral alar foramen. The importance of this one here, it's a passageway for the maxillary artery, vein, and nerve. So it's a passageway for maxillary artery and nerve. Very important. If you remember last time we talked about the infraorbital foramen, and as I said, from this area here we have the infraorbital artery, vein, and nerve. The maxillary artery that passes with the nerve that passes through the alar canal is going this way toward so we have the maxillary artery which passes through the alar canal with the nerve is going to continue to reach to the level of the maxillary foramen, and then it's going to pass through the infraorbital canal to exit as the infraorbital artery, vein, and nerve. So remember, this area here, we call it as this area here, when passes through the alar canal, we call it as maxillary, vein, and nerve, and artery. Once it's moved and passes through the maxillary foramen to reach to the level of the infraorbital foramen, exit as the infraorbital artery, vein, and nerve. So this is the opening here. You can see it more clear. We have the optic, which is a passage for the optic nerve. Then we have the orbital fissure, which is a passage for the ophthalmic, abducent, trochlear nerves. And we can see here, this is the area of the alar canal. We can see this is the beginning, which is called the caudal alar foramen, and the one that the arrow is past, this is the area of the rostral alar foramen. Together, they form the alar canal. As I said, the maxillary artery, vein, and nerve will pass from here through the maxillary foramen and exit as the infraorbital artery, vein, and nerve. The fourth bone we have, which is part from the unpaired bone, which is the ethmoid bone. And this is very important because this bone is hidden. We could not see it from outside. We have to cut open the skull to be able to see it. This bone here is the ethmoid bone, and it consists of three parts. We have the median perpendicular plate, which help in the formation of the nasal septum. We have the cribriform plate, this one here, which has all of these perforation. Also this one here, this is called the cribriform plate. And finally, we have this concha that found at this area here. Sometimes they call it as middle concha, or they call it as the ethmoid concha. So this one here, you can see this area here where we have this perforation. This is the cribriform plate. And then we have this one here, which is the perpendicular plate, which help in the formation of the nasal septum. We call it as the perpendicular plate of the ethmoid bone. And the last one here, see these three arrows? This one, the ectoterpinate, that help in the formation of the middle concha, or sometimes we call it ethmoid concha, or the other name, which is the ectoterpinate. And usually these middle concha or the ethmoid concha or the ectoterpinate contains the olfactory epithelium. And this is epithelium very important because the main function in the olfaction. The last thing I want to talk about in this lecture about the cavities of the skull. We talk about the cranial cavity, and I said several times we have a cranial cavity, and this cranial cavity encloses the brain and the meninges. Then we have the nasal cavity, and finally we have the paranasal sinuses. So we'll start the cranial cavity. This area here, all of this space that found inside the skull is called the cranial cavity. See this space here? This is called the cranial cavity. Usually the cranial cavity contains brain and its meninges and also the blood vessels that are responsible for nutrition of the brain. Usually the roof that found at this area here, we call it as calvaria, and it's formed rostrally from the frontal when we have parietal bone. We can see here this is the area of the cranial cavity. At this area here, this is the space. At the roof, we have of this cavity, we have the parietal and we have the frontal bone. Rostrally, which is the area here, cranially, is formed by the cribriform plate of the ethmoid bone. Caudally, we have the occipital bone, and in the floor, if you remember, we have the sphenoid and also we have the basosphenoid. All of these bones help in the formation of the cranial cavity. The second cavity we have the nasal cavity. If you remember, we have the nasal cavity and divided by the nasal septum into right and left nasal cavity. We have the opening to the exterior, to the outside of the body through the external nares, and also we have the opening to the pharynx through the caudal opening, which we call it cavani. As I said, the nasal cavity divided by nasal septum to two symmetrical halves, and usually the nasal septum consists of two parts. The nasal septum caudally, it's formed from bones, whereas the cranial portion usually from cartilage. The following bones help in the formation of the bony nasal septum. We have the perpendicular plate of the ethmoid, we have the septal processes of the frontal bone and nasal bone, and finally, if you remember, we have the vomer bone, which is part from the unpaired bone of the facial bone. So we can see here both the brain case bone help in the formation of the nasal septum, also part from the facial bone, which is the nasal bone, and the vomer bone help of the formation of the nasal septum. This is the area of the nasal septum. As I said, nasal bone, frontal bone, ethmoid bone, and perpendicular plate of the ethmoid bone with the vomer bone. All of these four bones help in the formation of the nasal septum. As I said, we divide the nasal cavity into right and left nasal cavity. Inside the nasal cavity, we have the concha, we have the dorsal concha, and we have the ventral concha. And we can see here, this is the area where the air can passes. And this area here, this is a conduit for the air. We have four, what we call it, nasal meatuses. The first one, which is the dorsal nasal meatus, is found at this area here. This is the area between the nasal bone and the dorsal concha. So this is the dorsal nasal meatus. As I said, between the dorsal nasal concha and the nasal bone. The second one we have the middle nasal meatus, and this one here is found. See this one here? This is the area between the dorsal concha and also the ventral nasal concha. So this one that's found at this area here and also at this area here, this one is called the middle nasal meatus. It lies between the dorsal and ventral nasal concha. The last one we have, which is the ventral nasal meatus. This is the area of the ventral This is the area between the ventral nasal concha and the floor of the nasal cavity. So the last one we have the ventral nasal meatus. It's found between the ventral nasal concha and the floor of the nasal cavity. This is the floor of the nasal cavity, and the space that found at this area here This one here is called the ventral nasal meatus. So we have the dorsal nasal meatus lies between the dorsal concha and the nasal bone at this area here. We have the second one, which is the middle nasal meatus, found between the dorsal nasal concha and the ventral, this area here. And finally, the one that found here between the ventral nasal concha and the floor of the nasal cavity is called the ventral nasal meatus. So these the three meatuses that found, and they are located between the concha and different structure. For example, the dorsal nasal meatus between the dorsal nasal concha and the nasal bone, and for the ventral nasal meatus between the ventral nasal concha and the floor of the nasal cavity. And the only one that found between the concha, the dorsal concha, and the ventral concha, this is the middle nasal meatus. The last one we have here, this is the one that found here, which is common for the three meatuses, which is the common nasal meatus. See this picture here? This is the area of the hard palate, and this is the area of the soft palate. See this one here? This is the area of the nasal bone, and this is the meatus that found at this area here. This is between the dorsal nasal concha and the nasal bone. This one we call it the dorsal nasal meatus. In this area here we have the ventral nasal concha, and the space between the dorsal nasal concha and the ventral nasal concha we call it as the middle nasal meatus. And finally, the one that found between the ventral nasal meatus and the floor of the nasal cavity, the hard palate, this one here is called the ventral nasal meatus. So again, this one here, this is the area of the nasal bone, and this is the floor. So this one space here between the dorsal nasal concha and nasal bone, the dorsal nasal meatus, and between the dorsal and ventral, the space we call it as the middle nasal meatus, and finally between the ventral nasal concha and the floor of the nasal cavity, we call it as the ventral nasal meatus. And the one that common for the three meatuses, we call it the common nasal meatuses. The final one I'm going to talk for today, which is the paranasal sinuses. The paranasal sinuses are diverticula of the nasal cavity lined by the nasal mucosa. As I said, we have the nasal cavity, we have the nasal septum. Any extension from the nasal cavity toward the bones, for example, for the maxillary bone or the frontal bone, and usually lined by the epithelium, this one is the diverticula. So the diverticula is the extension of the nasal cavity into the bones. And usually we have the best two examples of these paranasal sinuses. We have the frontal sinus, which found in the bones of the frontal, like the area of the frontal bone, and we have the maxillary recess, which is found in the maxillary bone. So the frontal sinus, we have several types of these sinuses. In the frontal bone, we have the lateral, medial, rostral, but we are going to talk about them later when we talk about the respiratory system. But for now, I need from you to know that we have the frontal sinus, and also we have the maxillary sinus. And usually you can see here, this is the area, an opening, big opening from the nasal cavity toward the maxillary bone. We call it as the entrance for the maxillary recess. So this nasal cavity will extend toward the bone, maxillary or the frontal, and both of them we call them as the paranasal sinuses. So this is the area, all of this bone that found with this one here, all of this bone is the facial bone, whereas the one that found caudally, all of that bone is the brain case bone. As I said, we have paired and we have the unpaired bone, both for the facial bone and for the brain case bone. So what we expect from you to read this lecture, and then we're going to go over these structures in the lab.